My name is Leonard Yared. I'm an obstetrician and gynaecologist, and I've worked at the Mater hospitals ever since I graduated some 40 years ago. I would never think of myself working anywhere else or doing anything else. As a first year resident, you did various terms in various specialties, and the one that really stood out as a first year resident was obstetrics. In second year, I was offered a 6-month job in obstetrics, which was unusual for a second year resident. And from that moment on, I knew obstetrics was what I wanted to do, and I've done nothing else ever since. The best aspect of working at the Mater Mothers is working with the fabulous bunch of midwives we have here. Very experienced, very knowledgeable, a lot of empathy shown towards patients. They work on a one-on-one basis in labour ward, and they just are part of a team such that I couldn't work without them. They are my contact with the patients, they are my right hand. And I think from that point of view, you wouldn't work anywhere else with a better bunch of people. Pregnancy is a fairly natural process and usually works very well. The vast majority of my patients, I tell them, will have an uncomplicated pregnancy and birth. It's their pregnancy. I want their input to the birth, and my role, I think, is one of supervision at a distance, but only getting involved if there are problems that might put themselves or their baby's health at risk. I also feel that when you're pregnant, you get a lot of advice from people that is sometimes confusing, conflicting, sometimes quite incorrect. It can worry people. They wonder whether they're doing the right thing or not doing the right thing. And if they really need clarification, they should ask their mum, the best person, their midwife, or myself. In practicing obstetrics as I do, it has given me a golden opportunity to develop a very warm relationship with the mother herself, husband, extended family, and children. Over the years, I have lost count of the number of women I have now delivered, having delivered them as babies, husbands as well, and on two occasions now I've delivered 3 generations of women. If I'm out somewhere, it always gives you a bit of a buzz when somebody calls out, "Hello, Dr. Yared." You know the face, you might not know the name, but you always ask how baby's going, how things are going, and it's a nice little conversation to have for a few seconds. And that's part of what I really enjoy about practicing.